Hey everyone, this is Russ Altman. Happy New Year from the team here at The Future of Everything. To kick off 2024, we're bringing you an episode that's been one of our most popular. The timing is just right as many of us are headed into the new year thinking about how to live better and healthier. In this episode, Professor Helen Blau, a stem cell biologist, tells us about how she's recruiting stem cells to regenerate youthful muscle in older people. We're thrilled to bring this episode out of the archives for another listen and renewed hope about possibilities ahead in the world of health. Before we jump into this episode, I'd like to ask you to rate and review the podcast. It'll help others figure out if they're interested in the future of everything. We all know that our muscles are critical. They help us move. They help us be strong as dancers, as runners, as walkers, as hikers, around the house, at work. You need your muscles. Not to mention the fact that your heart is a muscle and it beats about once per second for your entire life. The bad news is that for muscles, it's not just use it or lose it. Even if you're using your muscles, over time and with aging, you will lose muscle mass and muscle strength. This leads to all the problems that we see in the elderly: falling, unable to walk, unable to take care of themselves. A large part of that is because of weakened muscles. Helen Blau is a professor of stem cell biology at Stanford University. She and her colleagues study how muscle cells work and how muscle stem cells enable us to respond to injury and exercise with increased muscles. They've also figured out what goes wrong with aging and have some ideas and some potential medications that might be able to address the weakening of muscles in the elderly. Helen, you're an expert at the biology of muscle cells. So how does this relate to aging, which I know has been one of your focuses recently?
Well, aging is often depicted as this relentless process. You go from the vibrant babe to a glowing motherhood and then decrepit aging. And so my question is, does it really have to be that way? And can we address that? Can we ensure that you can live longer? But we are living longer. Both men and women have a longer life expectancy, a lifespan now. But this isn't with increased quality of life. We're living longer, but our health span is not increasing. So this reflects more years with chronic disease. And I guess my goal and the goal of regenerative medicine is to improve that quality of life and to ensure that we can do the things we want to do as we age, so that you can run and ski and do all the things you love to do, even though you're older.
So you use this phrase, regenerative medicine. And for people who haven't been following along, I mean, it sounds magical maybe that, what are we going to regenerate? But where are we and what is the field all about?
So it's about stem cells and using stem cells in order to regenerate the tissues of your body, to improve the quality of those tissues with aging. And there are various kinds of stem cells that can be used. So you have stem cells in many tissues of your body. And for instance, in the skin, in the muscle, in the brain. And if we could stimulate the stem cells that reside in those tissues to function better, that's one approach to improving quality of life. And another is stem cells that are being made now from your blood or your skin, and that can be made into pluripotent cells. They can be like embryonic stem cells.
Yes.
By simply overexpressing 4 transcription factors that Yamanaka defined. And these cells then are pluripotent. They can become anything. And you can then redirect them to be cardiomyocytes or to be other cell types in the body and use those to replenish the tissues. And that's being used, for instance, in the treatment of certain eye disorders.
And so this regenerative medicine really is now a thing with respect to it's starting to impact patients.
That's right.
Now, your focus has been on muscle traditionally. And tell me, what do we need to know about muscles? Many people never think about their muscles except when they fail them. This has been the work of your career. Tell us about muscle cells.
Okay. But first, I want to tell you about the wish for rejuvenation and regeneration.
Sounds good.
There's a wonderful Roman myth, the Aurora myth. Aurora was a goddess, and she fell in love with a mortal named Troy. And she wanted to live with him forever, but he was mortal and he was going to die. So she went to Jupiter, the king of the gods, and said, I have a wish. He said, I'll grant you one wish. And she said, I would like to have him live forever. I'd like him to be immortal. And what she forgot to ask for was he lived forever, but he aged and he was old forever. She forgot to ask for eternal youth. And so I think that's a very important concept that we want. We want quality of life. We want health span. So muscle, why do I focus on muscle? Well, muscle is central to everything you do in life. If you're a dancer in the ballet, or even if you're a Rodin's thinker, you're using your muscles in your diaphragm to breathe. And if you're Steph Curry, you're using every muscle in your body to shoot those 3-pointers. So muscle is crucial to your quality of life. And as you age, it can be quite devastating. So your muscles weaken and they shrink, they atrophy.
This is even without disease? Is this like a normal, this will happen to everybody?
Yes, this is aging. And some people are more affected than others, but it's known as sarcopenia, that your muscles progressively atrophy and weaken and become smaller with age. And by age 60, I'd say 5% of the population are sarcopenic, have severe muscle wasting that is, debilitating. By the age of 80, 1/3 of the population. So that's a very high proportion.
And I'm sure people want to know, is this even if you do exercise and try to stay active?
Exercise helps a lot. Exercise and being active can counteract many of the effects of aging, including both mental and physical, but certainly aging muscle.
So, okay, we have these, it seems like an inexorable process. What have we discovered biologically about the ways that we might be able, I presume we want to try to battle that we're not going to just sit and accept that as something that must happen. Yeah. I mean, people, I could imagine people saying like, well, what about steroids? Should we be taking steroids like the muscle builders? What are the approaches to understanding how to help the muscles move along during aging?
Yeah, so just to explain what sarcopenia is like, this muscle wasting, it leads to frailty and then increased falls and then dependency, and people end up in institutions and they die prematurely. So it's pretty severe having sarcopenia. Yeah. So we definitely want to combat it. And there currently are no drugs available that really address this. So there are different kinds of research approaches that are being taken. One is to target the stem cells that reside in the muscles and try to stimulate them to regenerate the muscle and rejuvenate it. And another approach is to target the muscle fibers, the mature muscle tissue, and try and rejuvenate that and have it function better. So these are very much in experimental stages. The stem cells reside in the tissue. They're present along the muscle fibers, and they are stem cells that are dedicated just to the repair of muscle and can spring into action. When there's an injury, they spring into action, they divide, and they can then fuse into the muscle and replenish it. So we have stem cells that are there. The problem is that with aging, those stem cells become less functional. 2/3 of them become dysfunctional with aging, as we determine with various studies of transplantation and looking at regeneration of tissue. So the challenge is to rejuvenate their function and find ways to enhance their repair of muscle with age.
So tell me what your lab has been doing recently, because I know you're very excited about some discoveries and some engineering capabilities that you've developed.
One of the first things we did in order to find ways to stimulate the stem cells is to identify the stem cells, because you have to be able to isolate them, to characterize them, to study things that can alter their function. And so we tested different cell sorting regimens, different cocktails of antibodies that could be used to purify the stem cells. And we were enabled in those studies by a mouse model we built that is a transgenic model that expresses GFP, green fluorescent protein, and luciferase in every cell of the body. That allows you then to monitor stem cell function by bioluminescence imaging. So in a non-invasive way, you put the animal in a camera and you can look at the glow and determine how well the stem cells are functioning and expanding to meet the need of the injury. And that allowed us to then determine which antigens could be used to purify those stem cells. But then we encountered a new problem, which is once we had the stem cells in culture, they lost their stem cell properties. So we couldn't really study them. And that was a huge bummer, a real challenge. And so we reasoned we had to figure out a way to recreate the niche, the microenvironment that's present in the body that maintains the stem cells. And we reasoned, so I had some bioengineers. I love to have a multidisciplinary group in the lab, and I had bioengineers, artificial intelligence experts, chemical engineers work together on this. And we reasoned that maybe this microenvironment, the elasticity of the microenvironment might change with aging. We know that tissues get stiffer, they get more fibrotic with aging and also with disease, with dystrophy. And so we measured the rigidity of the tissue, the stiffness of the tissue, and found that, lo and behold, it is much softer than anything you see in tissue culture, 5 orders of magnitude. So the stem cells never see anything as rigid as tissue culture plastic.
And that actually set them into a whole bad state where they didn't even look like stem cells anymore.
That's right. That's right. They didn't function as stem cells. They couldn't regenerate the tissue. They were lost and specialized and no longer stem cells. So we bioengineered microenvironments with PEG hydrogels, and we could modulate then the stiffness of the material so that we could maintain the stem cells. And we made a material that was exactly the modulus of a healthy young tissue. Right. And lo and behold, the stem cells could be maintained in culture. So that was a little breakthrough that allowed us then to characterize these cells further.
Can these stem cells actually become better than they were in the elderly adult from which they were taken, because now it's a more youthful-like environment, or can you only get back to a certain point of goodness?
You only get back to a certain point of goodness with the material.
Okay.
But it tells us that stem cells care. I like to call it the Goldie cell myth, like Goldilocks, that one is too soft and one is too stiff and one material is just right. So stem cells care just like we do about what beds they're on. But that maintains them, but it doesn't enhance their function.
And now that you have them and you've isolated them, and of course you can study them, I'm guessing that you've learned what they like, what they don't like, and how to get them to be a little bit more enthusiastic about regenerating in the older folks.
That's right. So that's what we did. We characterized them, and we determined, for instance, we did a candidate screen, and we found that a P38 MAP kinase inhibitor would cause the cells to expand and rejuvenated their function so that we could transplant similar numbers and they could restore function. So this was a very nice method for an ex vivo treatment, a cell therapy. So you could treat the cells, and interestingly, if you treated the cells with the P38 MAP kinase inhibitor on a stiff material, it didn't work. If you needed the synergy of the material that had the elasticity of a young microenvironment, a young niche, in conjunction with the inhibitor of the deleterious signaling pathway. And then those two together, there was a synergy of biochemical and biophysical cues that enabled the stem cells to function better in regeneration. And then they would function as well as young when we transplanted them.
So I presume you're doing this work in like mice or rats, is that right?
Yes, we're doing it in mice.
And do you literally inject these back into the muscle and then they start proliferating, or is it much more complicated than that?
So we inject them back into the injured muscles of a mouse after a muscle injury. And then we see them restore and regenerate the tissue very well. The problem is that it's an ex vivo treatment, which is not very cost effective, labor intensive. If you do this in vivo, the pathway impacts the immune system as well. And so it's not a very useful in vivo approach. So we then turned to other approaches. And this leads me to the breakthrough that I'm so excited about.
Awesome.
That I told you about. So we reasoned that one of the first things that happens after an injury is there's a wave of inflammation. And mostly one thinks of that as not a very, you don't want to recreate that wave, but we thought that maybe it is something that the stem cells are uniquely sensitive to that we could take advantage of. And so we did a screen, an in silico screen. We looked for regulators in muscle stem cells after they were isolated after an injury, both in our own database, transcriptome analysis, look at what they're synthesizing. And we were looking for things that were immune regulators. And we found that EP4, which is the receptor for prostaglandin E2, which is an immune modulator, was one of the highest hits. And so we were fascinated, and we found that, in fact, prostaglandin E2, which acts on that receptor to signal the stem cells, was expressed at higher levels after injury. So to find out if that was really an important signaling pathway, we eliminated the receptor genetically in mice, specifically on the stem cells. Then we created an injury, and we found that the stem cells could not, in young mice, could not meet the needs of the injury. They couldn't expand. They couldn't repair the injury. So this signaling pathway is really, really important.
Right. Okay, great. So now we have this very important receptor molecule involved in the inflammation. So tell me if I'm wrong, but everybody's had the experience of doing a lot of exercise or an injury, and you feel pain in your muscles, and they often then grow back, bigger and stronger. Is this the same phenomenon, or is that an entirely different thing?
Absolutely, it is the same phenomenon. So, for instance, we did an experiment then where we after an injury to a young mouse, we gave the mouse an NSAID, a non-steroidal anti-inflammatory agent, like ibuprofen, an equivalent.
Ibuprofen, naproxen, all of our favorites.
Exactly. And what we saw was the stem cells couldn't repair the damage, and strength dropped by 50% in these young mice. So they absolutely need the signaling pathway in order to repair the damage. So what you do when you're exercising, this is a good kind of damage. You need that in order to build your muscles, but that is what you're doing. It's a little bit of damage to the muscle, then the stem cells kick in and replenish it, and that's how you build muscle. And if you block that pathway by taking an anti-inflammatory agent right after you work out when you're feeling kind of achy, and
oh my goodness!
Then you're negating the good you did. It's like no pain, no gain.
There's a very important takeaway. Do not treat those muscle pains with your favorite non-steroidals. Now, Helen, in the beginning of our conversation, you talked about how aging leads to basically all of our muscles starting to be less good, and you talked about a 10% reduction and then a 30% reduction. So there's this problem of all the muscles, and it's not just a single injury to a single muscle. So what are the prospects for trying to get our body to take care of all the muscles and have them all regenerate, or at least stay at the youthful levels?
So this prostaglandin pathway, this inflammatory pathway, really stimulated our thinking. And we reasoned that that maybe we could stimulate stem cells in all of the muscles if we could find a way to systemically alter this, because the experiments I described were very local. We were injecting prostaglandin E2 into the muscle, and that's not a very clinically useful approach. So we reasoned that maybe there was another way that we could target this pathway and increase prostaglandin E2 throughout the body. So we looked at the different metabolisms, different metabolic pathways, and we found that the prostaglandin degrading enzyme, 15-PGDH, increases with aging. And that enzyme is responsible for degrading PGE2. And for unknown reasons, it increases just a little bit, maybe 30% with aging. So we wondered whether that makes a difference. And we looked at the levels of prostaglandin E2 using a very sensitive mass spec method, and we found that they decline by about 50% with aging. And
So this is a paradoxical. Let me make sure I
Yeah,
understand. This is paradoxical because the body is creating this more of this enzyme that is not actually helping the muscle. It's actually kind of hurting the muscle.
that's right. It's one of
Okay.
those things with aging that's, like Alzheimer's. It's not great.
Right. Right.
And we don't know why it's happening. We don't know what controls it. We want to find that out. But in the meantime, we thought maybe we can target it. Maybe we could inhibit that enzyme somewhat so that we could restore muscle function throughout the body.
Right. Right.
And in fact, we are able to do that. So we found a small molecule inhibitor that partially blocks the activity of that enzyme. And as a result, you get an increase in prostaglandin E2 back to youthful levels. So you're just modulating it back to a youthful level. You're not overshooting. That's part of the beauty of this.
It's another one of these Goldilocks situations.
Yeah, exactly. Physiologic modulation of the levels. And when we did that in mice and we just restored their PGE2 levels back to youthful levels, we found that their muscles got bigger.
Oh my goodness.
All of the muscles, the slow contracting, the fast contracting, mixed contracting, and not just it got bigger, but they also got stronger. And we could look at their strength in displacement of, can they push this foot pedal? And we could see they could do that better. And for each mouse, even for young mice, then we saw a difference if you compared the mice at the beginning of the experiment and the end of 1 month of treatment. So we would treat for 1 month and we would see that they got stronger, like 15 to 20% increase in strength.
Oh, that is a very significant. I mean, that's for an elderly person, that's the difference between falling and not falling.
That's right. Yeah.
Okay, so now these are mice, but I have to ask you the question, what's the chances of getting this into humans?
Yeah, so we're super excited about this because it also stimulates all the right metabolic pathways. It stimulates mitochondria function and metabolism, and it inhibits protein degradation that happens with aging. So can we do this with people? So the mice that we were treating, we've been giving them the drug intraperitoneally. That's an injection
into the abdomen.
Into the abdomen. People don't really want that. So, and I applied for a grant to bring this to people, to do a clinical trial from the DoD. And they wrote back, in the review, this is a wonderful collaboration with the surgeon. We're really in favor of Blau's work. Once you have an FDA-approved drug, come back to us and we'll fund you. And that was a huge roadblock. That is not easy at all. So I founded a biotech company because it's the only way to bring it to people. We needed to develop a drug that was something people would want to take, an oral drug, and something that could be IP protected so investors would invest in it. And also that a company really knows what to do to meet FDA approval, all the toxicology.
And they can have the scale of resources that you need. And at a certain point, the academic setting might not be the best place to develop a drug.
Exactly. We don't have the know-how. We don't have the resources. And it's very well done by companies. So my hope is that, so we have shown that this works in mouse models of aging and also in certain muscular dystrophies. So my hope is that this really will reach people and that we can systemically increase muscle function in a physiologic manner that could really benefit people.
Are we still looking for that oral drug that might get into mouse or humans, or do we have candidates for that, or is that the focus right now, is to find the thing that we can take by mouth?
No, we have candidates. We have IP protected candidates, and we're testing those, and they seem to work even better than what I did in the lab. So that's hugely exciting.
What about side effects? I'm sure people know that they're new drugs. We're always worried about side effects. Are they showing side effects?
No, they're actually not showing side effects. And we were concerned about that. And one thing that gives us hope for this drug is that there are pedigrees of people who have mutations, who lack the enzyme completely. So we're inhibiting it just a little bit. But people who lack the enzyme completely are not showing strong side effects. So that's very reassuring.
Do they have big muscles?
It has not been reported in the literature. There are about 5 pedigrees. I've actually written to the physicians who reported on them. And I don't think they looked at the muscles.
But we would love to know if they're strong,
Yes,
big, strong people.
exactly. We would like to know that, and hopefully they are.
So I know that it's very hard to predict the future, but for people who are wondering about the availability of this treatment in the future, what's the typical timeline for these kinds of companies and these kinds of products? Is this a 20-year, 10-year, 5-year horizon?
Hopefully 5-year. We're aiming to be in the clinic and do a phase 1 safety trial in the next year or so. And that could be combined with some kind of efficacy study as well. So I would say 5-year timeline.
Incredibly exciting. And what about going back to the local injury? That's a whole different class of folks. Who do you think are the people who are going to benefit from these treatments first before we're all taking it so we all get stronger? Usually these things roll out in a little bit more of a careful way. Who are the first patients who who might need this drug?
Yeah, some of the things we've been thinking about are sphincters for localized treatment, sphincters, urinary incontinence, fecal incontinence, or carpal tunnel syndrome, localized treatment of the muscle of the thumb, eye muscles that could be strengthened. Now people, if you have two eyes that are different, the muscles are different, they weaken the strong one. We'd like to strengthen the weak one.
Right.
So that would be another indication.
I just have to ask, has this work gotten on the radar of the sports industry? And are you getting inquiries from people who want to make their athletes? You mentioned Steph Curry earlier. Is there people who are thinking about, we can use this for enhancement of people who are already very talented and strong?
Not yet.
Okay. Probably good news, actually.
That's probably good news, yes.
You have been listening to the Future of Everything podcast with Russ Altman. I want to remind you that the Future of Everything started out as a radio show on SiriusXM, so you'll hear references to that. Now it is 100% podcast. We have more than 200 interviews in our archive, and they cover an extraordinary range of topics. If you're enjoying the podcast, please consider subscribing or following so that you can be alerted to every new episode and never be surprised by the future. Maybe tell your friends about it too. Definitely consider rating and reviewing it. That helps us grow, improve, and also spreads the word. You can connect with me on Twitter at RBAltman and with Stanford Engineering at StanfordENG.